Okay, have you ever wondered how they know how much drug to give a patient? Well, besides doing studies for determining toxic dose and efficiency dose, right? We have the lethal dose 50, the effective dose 50. Well, they also do therapeutic range dosing. So basically what therapeutic range dosing is that they take the drug concentration in the body that produces the desired effect with the little or no side effects of signs of toxicity. Okay, so when you're in this therapeutic range, that is where you don't have, where you have effectiveness. So this would be kind of like your LD 50 or your ED 50, and then you have your minimum toxic concentration. This would be like your LD 50. Okay, so your therapeutic range is in between these two numbers. We also have peak action, and what peak action is when the drug hits its highest plasma level. So when the plasma is bound to the drug, okay? And then duration of action, this is the length of time the drug produces the desired effect. So is it going to give us 15 minutes of pain management? Is it going to give us 2 hours? That's what we call the duration of effect. So therapeutic range sometimes is a little difficult to understand. So this is how I understand it the best for me. So I look at it as the 3 bears, okay? So, you know, you have the mama bear, the papa bear, and the baby bear, okay? The papa bear, his porridge was too hot. The mama bear, her porridge was too cold. And the baby bear was just right. So when we're talking about therapeutic range, we want to make sure we get into the just right range. Okay, so this would be the drug. This would be a drug, probably an oral medication. So we give the oral medication, okay, and then we have the onset of action. So the onset of action is the time between when the drug is given and when it hits the minimum effective concentration. Okay. Then we move up into the therapeutic range. Okay. Hopefully we stay under the minimum toxic concentration. Okay. So at the very top here, this is the peak concentration level. This is when we get when the most drug is in the plasma. Okay. And then as it tapers down, okay, once we get below the MEC is where the duration of action stops. Okay, so once it hits the subtherapeutic range. So duration of action is from the time of onset to the time that it drops below MEC. Okay, and then this is an IV drug. So with an IV drug, we actually, when you calculate it out, you're calculating it out to give at peak concentration because you want to give it, you want the action to happen immediately. If you're anesthetizing an animal, you want to use this peak concentration level to get them under anesthesia. And then as the time progresses, the duration of action progresses, okay, right? So once it drops below the MEC and gets into the subtherapeutic range, that's when the duration of action stops, okay? So ideally, when we're doing IV drugs, we want to keep under that toxic dose, right? Papa Bear's porridge is too hot. We don't want it to go too hot. We don't want to be too cold. We want to be just right. Thank you.